just a moment. I am getting our YouTube channel going so that we'll be live as well on there. So you can watch us if you would like. And also we are streaming around the globe at 88.3 FM and kgua.org and on apps Radio Garden and Tune In. It is 59 degrees outside under mostly blue skies, a little fog up there, and maybe a little smoke from some of the fires that are east of us, the Dixie Fire and also the River Fire. But we will find out if anybody has any information on that. Please do let us know. We heard a report that there was going to be some smoke drifting over this Sunday. Maybe it got here a little early. But I do want to talk about a couple of announcements first before we get into our show with the Mendonoma Health Alliance ladies who are with me right now, just hanging out. And first up in Point Arena, of course, every Friday it's the Point Arena Farmers Market. And that goes from 3 to 6 p.m. in the general store parking lot and also in the pizza near Point Arena Pizza in Arena Cove. There is going to be music, waves, and tunes with DJ Yasmin, who's going to be playing funky soul music or soulful music at this summer dance party that goes from 3 to 8 p.m. And then on this Saturday, it is the monthly pay and take, and that will be from 9 a.m. to 12 p.m. And then also the Wallala Farmers Market goes from 9:30 to 12:30 p.m. And we have some music returning to the Cypress Village. That's going to be right here at the Dolphin Gallery with Jim and Sharon Lieberman, Bards of a Feather. They'll play a mix of oldies and some newer tunes. That'll be from 12 to 2 p.m. And then there's a special thing happening up in Point Arena at the Lighthouse at 10 a.m. on Saturday morning. And it is National Lighthouse Day. And they are celebrating their 150th anniversary from last year. They're finally going to get an award from or a special legislative proclamation that is coming from the California State Assembly member Jim Wood, who is going to recognize their 150th anniversary from last year, which they were really unable to hold because of the pandemic. So they're going to hold it this time, 10 a.m. up in Point Arena at the Lighthouse. And that sounds like a fun time. And then we have other galleries also up in the Point Arena area. That is the Coast Highway Art Collective. And they do have events that are going on that have already started with Phil Clark and Emma Hurley. There's woodwork, ceramics, clothing, and that is going to be going through the 29th of August. And they're going to have an opening exhibit August 14th, 12 noon to 5. But every week they're open Thursday through Sunday, 11 a.m. to 3 p.m. And that's Thursday through Sunday. And then we have up in Fort Bragg, the Symphony of the Redwoods presents 4 outdoor summer concerts. And that's going to be, the last one is going to be happening this weekend. And that's going to be August 8th. And that is in the Mendocino Coast Botanical Gardens. And I believe that may be the last of what we are going to be talking about as far as exhibits go. One last thing. Oh, there is at the Discovery Gallery, they have an ongoing exhibit that is showing all of the Discovery tour. That's a preview show, and it's going to be half of their new gallery space. And that's right there next to Trinks here in Molalla. And that will do it for now. We've got more things. We do have Cartwheels on the Sky that's going to be playing this Saturday, 7 to 7:30. And that will be featuring poems in the process of Northern California poet and best-selling author Susan Wooldridge. And she has held workshops on creative language and process with thousands of adults and children. So more about that will be coming up on our post on Facebook and other social media announcements. And now it's time to get into our show with Mendonoma Health Alliance. And we've got Heather Reggelbrugge, and we have Stephanie Chapman and Joanne Gamble. Good morning, ladies.
Good morning.
Good morning, Leanne.
It sounds like you guys have a lot of announcements to talk to us about. I'm going to be preparing a public service announcements for you today so that we can run it for you, but I'm going to let you guys take it away and tell us what's up.
Well, I'm gonna just start off really quick with I'm at home and my coworkers are at the office, but we have a medication or prescription take back event coming back up of this month, August 26th. Our last one was really, really successful. People were asking as they were dropping off the medication when the next one was going to be. So we have that coming up August 26th. We will be, we always do this in conjunction with Mendocino County Sheriff's Office. Deputy named Julie Whipple does it with us. So she will be coming down and we're going to actually do 2 in 1 day. So we'll be in front of Wallala Pharmacy. It's a drop-off, drive-by. You can open your car window and hand it to us event from 9:12 in front of Wallala Pharmacy. And then we're going to move on to Point Arena from 12:30 until 3:30. And we're going to be in front of the bus stop, kind of like next to the theater parking lot over there as well. So any unused, unwanted medications, you may come by and drop that off with us. And Julie Whipple then takes that back up to Fort Bragg and disposes of them.
That's great. So if you're going to be showing up for either pay and take or farmer's market, you can stop over to the pharmacy and drop off your unused meds as well.
So and actually, that's actually August 26th, which is a Thursday.
Oh, I'm sorry. I was thinking this Saturday for some reason. My brain is still on weekend events.
We have just a little while to get the word out there.
Okay, so that's Thursday, August 26th. And if anybody needs more information, you can contact Mendonoma Health Alliance at 707-412-3176, extension 102.
Yep, perfect.
And then you also have more things that are going on in, it looks like September, is it? There's the free Narcan training and addiction education workshop.
Mm-hmm. Yes, that's going to be a virtual training. We had one last month. It was very successful. We have a doctor of pharmacy. She works at Kaiser over in Santa Rosa. Her name is Emily, and she just brings a lot of great information and training on Narcan and talking a little bit about stigma and how to reduce stigma. And we will also provide Narcan to anyone that takes the training.
Why don't you tell the audience what Narcan is, because not everyone knows.
Oh yeah, I'm going to hand this one to Joanne.
So Narcan is a medication that reverses the effects of opioids. So if somebody is experiencing an overdose, the Narcan is given to them and reverses it. So it gives them the potential to save their life.
And opioid addiction is rampant in the country in general. What is it like along here on our coast in our community?
It's a major problem in our community. We've had, excuse me, we've had the highest per capita rates 2 years running in Point Arena and Wallala in the state for opioid overdoses. And I know that in the state, and so 2019, Wallala was the highest in the county in the state per capita for overdose deaths for opioids. And in 2000, I'm forgetting now, 17, I believe it was Point Arena. We also have just a high level of prescriptions in the area as well. They also per capita, that part of that is because of our large elderly population as well. But we also know that about 12% of the population has some sort of addiction in general. And we gathered that from a needs assessment that we did in 2018. So it is a large issue here. The connections we have with the ambulance service too, we get reports on how many reversals are done with Narcan, and it's significant.
So
Oh,
this is coming up on September the 9th, Thursday, and
Mhm.
it's an online event,
Yes, virtual. Mhm.
virtual. And so where can people find information about how to get the Zoom link?
Oh, yes. So that will be coming out on Monday. We're getting the ad out. It's just being updated. So it'll be on Facebook. You can call us. We'll email it to you. It'll be on our flyers. So it's just a couple of days to get that.
And on your website, I assume?
Thank you. Yes. Yes, Leanne.
oh yeah.
I need
Mendonoma Health.
reminders too. So
MendonomaHealth.org.
Mendonomahealth.org. Great. Okay, so that sounds like it's something very important for our community. And in fact, anybody that would like to learn more about it, they can also join in as well. That they want to help people who perhaps are coping with this and they want to get the information for them, say. All right. And so what is up then next, ladies?
Yeah. Since you mentioned September, switching gears a little bit. So Heather and I are going to do a training of leader trainers for our healthy living course. And so basically anyone that wants to do something good for others, thank you. Yes, Leanne, that's our flyer. Yeah. If
That's
you
for
want
our
to,
YouTube watchers out there.
I love it. I love it. Great idea. And so the details are just it's a 6-week course and we meet on Tuesdays and Thursdays. And basically you'll learn the class that you're teaching and then you'll learn how to teach it. And so that's what the Tuesday and Thursday sessions are for. And it's basically to empower people living with chronic diseases or illnesses, how to make changes in their lives and achieve their goals.
Say that again.
So basically, the class is to help people learn how to self-manage and make changes in their lives. So it's just, showing information that's proven to be effective and people can start to make changes in their lives.
Those who are dealing with any kind of chronic condition then.
Yes, yes.
That's who have chronic conditions as well.
Can you name a few of what people may be, living through that this will help?
Diabetes, hypertension, COPD, cancer, all sorts of those kind of things that do not necessarily go away, but
Mhm.
A whole range.
exactly that you live with, but are able to. It really does exactly what Steph said. It really teaches you to chunk up those big goals so that they're attainable and achievable, and realistic.
That's good. Good way to put that. And a lot of times it's breaking things down into smaller components to be able to achieve what you want to achieve. I know sometimes it gets to be overwhelming when we especially have news again about the COVID pandemic, the Delta variant, and it's all impacting our lives and our schedules, that sometimes people feel overwhelmed or just too much on their plate. And they may freeze up and go, now I can't do anything. I'm just frozen. So sometimes it's okay if you get to that point, then break it down into smaller components and finish one of those and then go on to the next.
Absolutely.
Yeah.
Yes.
And I know that, this is an older population, even though we've had a big influx come in over this past year and a half with new residents that are much younger with families and such, but we still have an aging older population too that has a wide variety of these different conditions. So this sounds like a really good workshop, and it's a free 13-session class that goes from September 14th through October 21st. And it's every Tuesday and Thursday on Zoom, 9:30 to noon. And they can call you to register right at 412-3176. That's area code 707. And again, extension 102, correct?
Absolutely. And
Yes.
I want to let you know that it really is not just for our older population. I mean, you can have a chronic disease and not be older.
Well,
And actually,
that is true. I'm glad you pointed that out.
The last class that Steph and I taught actually was full of, just kind of a middle, it had it was a eclectic group of people age range. And so we had some younger people in that class as well. So
Sure, diabetes can strike at just about any age, I would imagine. Yeah.
Yeah. And also I just want to remind those listening that this specific session is for people that are interested in teaching this to our community in conjunction with us. So it's a wonderful opportunity to meet new people and also just like make changes in your own life. Every time that Heather and I teach this course, because we're teaching this, thank you, we're teaching kind of like goal setting with our group. Heather and I happen to just set some new goals and kind of achieve them too. So it's really inspiring. It's really fun and just a wonderful way to give back to our community.
I was just going to say that it's a great way to help the community to get involved and to do something that is fulfilling. Absolutely. Because you're helping others. Mm-hmm. Great. Well, is there, so that's the care, that's the health management workshop. Is that the same as the care transitions program? That's a different thing. Let's hear about that.
Our care transitions program is an ongoing program that follows people from hospital to home. Our goal is to keep you out of the hospital by making sure that you have all of your appointments with your PCP, your primary care provider, or any specialist that you have, that all those appointments are kept, that you have all the medications that you need. If you are in need of some durable medical equipment, that you have that as well. And just any barriers to getting well, we like to address. We're back to being able to do home visits, so we can come see you in your home, chat with you, make sure that things are okay, check in on you on a regular basis. So this is a program that can be self-referral. We often get calls from the hospitals to people who are discharging in our service area. And remember, our service area is Timber Cove to Irish Beach. And so basically the hospitals give us a call, say, hey, this person is coming home. Can you check in on them, make sure they have what they need? So that's our care transitions program.
That hand holding is really beneficial and can help coordinate a lot of different things that perhaps they're coming back from this experience and they just need that support. They need that help.
Absolutely.
Even with coordinating with coastal seniors for the meal program.
Mm-hmm. Or have a run appointment, or making sure that you did call your primary care provider for that post-hospital discharge appointment. So, and making sure that you have all those medications, and sometimes the discharge summaries from the hospitals are confusing, and it's a lot of information. You're sent home with paperwork, and it's sometimes difficult to comb through that. So it's good to have another set of eyes on that paperwork just to make sure you're doing what you need to do to stay healthy.
Well, if you're just tuning in, you're listening to Mendonoma Health Alliance workers, and that is Heather Reggelbrugge, Joanne Gamble, and also Stephanie Chapman. This is Leigh and Lindsey on Peggy's Place here at KGUA in Wallala, 88.3 FM. We are streaming around the world at kgua.org with our Air Pocket app, and also on Radio Garden and TuneIn. And we are hearing about all the different things that Mendonoma Health Alliance does for our community as an organization that collaborates with the other medical organizations here in our area, with RCMS, with Coastal Life Support, with the ambulances. You guys are just so connected all the way around, and you get grants in, you get the funds in to help our community. So that's what you're here to let people know what it is that they can take advantage of. And you started out talking about the medication take back event that is on Thursday, August the 26th, and that's 9 a.m. to 12 p.m. here at the Wallala Pharmacy, and then up in Point Arena from 12:30 to 3:30. And that's going to be in front of the bus stop on Main Street. And then you talked about your free Narcan training and addiction education workshop, and also the health management workshop that's coming up in September through October. and now your care transitions program. I know that you've got so much more, so I'm going to let you guys now take it from here.
Thank you, Leanne. I'm just going to jump in, and we're really excited that, whatever. We're going to do our health screenings again out in the community. We're going to be outdoors, so we're going to be wearing our masks still, but we're just excited to be available again for our community. And this time around, we're introducing our A1C screenings. So in addition to cholesterol and blood pressure, we can check out how your A1C numbers are doing and see if you want to make that appointment with your primary care, or if you're just happy to hear that you're doing better with your A1C, your blood glucose.
This blood glucose over the last 3 months.
Well, I know someone had wanted to get their blood pressure done by you guys the other day, but they weren't sure of your hours or where you were. So why don't you explain that to us?
Thanks. Yes, Leanne. So basically, for our screenings, we have appointments available Monday through Thursday from 9 to 3 p.m. So just give us a call, or if you're walking up the hill, pop in and we'll schedule you for an appointment. And then the community dates that will be out, we're going to start Saturday, August 21st over at Art in the Redwoods. We're going to have a little table over there from 10 a.m. to 1 p.m. offering cholesterol, blood pressure, and A1C screenings.
That's
and then,
great.
Yes. And then we're going to head over to S&B Market over in Manchester. I know a lot of people like to visit that store, so we're going to be there again on Wednesday, August 25th from 10 a.m. to 12 p.m. Again, cholesterol, A1C, and blood pressure screenings. And then last day for August, we're going to do August 29th. There's a Sunday market over in Timber Cove at the Fort Ross School. A lot of community members like to just have a cup of coffee over there and catch up. And so we're going to join them from 10 a.m. to 12 p.m. Again, August 29th, offering blood pressure, A1C, and cholesterol screenings.
Thank you. That was Stephanie Chapman. I was wondering what you were going to do down in Timber Cove. That was my next question, and then you answered it.
Nice.
Now, you also provide support for people in a variety of ways from your grants. Are you still continuing some of those programs too?
All of them.
I'll ask Heather.
I'll let everybody else jump in. All of our programs are continuing. We actually never stopped really any of them. We had to alter them a little bit, like with our care transitions program. We weren't able to go to the homes, but our office was always open to whomever needed a hand. So our care coordination, our care transitions, our chronic care management, which is that healthy living course, all of our health screenings were by appointment in our office. And now, like Stephanie said, we're able to go out into the community a little bit more. With school starting back up, our prevention education programs will be going again. We're starting with some training for some of the school staff on anti-stigma and Narcan, like the Narcan training, the virtual training that we'll be doing. And then when school begins and the teachers are set back in their classrooms, we'll start with some prevention education with our middle school students. Hoping to do the health fair again this year. We missed doing it this year. Yeah, so that is tentatively on the books for October. And hopefully we'll be able to do that like we have in the past. So all of the programs that Mendonoma Health Alliance offers have continued to go throughout the pandemic and are still going strong and a little bit better now that we're able to move back out into the community. Did I miss anything, ladies?
Well, you also provide some financial support to those that need it. So if you could tell a little bit more about how you do that.
So that portion, I was wondering, Leanne, if that's what you meant. And so those funds did end June 30th. They were specific from the Community Foundation and I believe the Lions Club, and it was specifically for the pandemic. And, since June 1st, the governor did open the state back up. And so we closed that program.
Well, Go ahead, Joanne.
Oh, I was gonna say, we exhausted the funds that we were able to use for it.
We're thankful that you were able to raise the funds to be able to distribute them like that to our community. And I'm sure you'll be doing other programs like that in the future. And I actually have a question too. When you bring up about opening things back up again, and then we get all these reports about the Delta variant and how aggressive and highly transmissible it is, and people are beginning to rethink what their plans are once again, and some are canceling plans, organizations, individuals. So how will your programs be affected if at all?
I think we're gonna have to be highly adaptable. So I think that we'll continue to do what
I think everybody's learned.
Yeah.
Yep, highly adaptable.
We just have to deal with whatever comes with us and adapt to be able to still provide our services in the best way that we can. Because yeah, we don't know what things will look like in a month from now versus what they look like now, but we'll continue to do our best to get people what they need
in a safe way, offering masks. If you don't have one and you got to come in our office, we'll give you one. We have hand sanitizer everywhere, except for this right now. We do the 6 feet, the 6 feet distance, and just constantly being responsible in that way.
That's really good. And here at the studios, as we can see here, we've gone back to using Zoom again instead of doing in-studio personal, visits, which is nice. But at the same time, we're just taking that extra measure again to make sure that we protect everybody and ourselves. And that's just something we need to do. And it's kind of like getting in your car and putting on that seatbelt, or you want to get on that bike, you put on a helmet, put on your mask, take the measures you need to do to protect yourself and to protect other people in our community. So I'm glad that you guys are doing that. Yes, Heather, you had something you wanted to say.
I just want to make sure that though the monies that were given to us from community foundations and Lions Clubs and Walla Community Center, even those have been exhausted by use for our community. I want people to know too that there are still people struggling out there, and there are still people struggling to put food on the table. And so if you are still struggling to put food on your table and you still need help, that we still can help. So we still have access to food bank on non-food bank days. We can make sure that you and your kids do not go hungry. So I just want to put that out there. And there's also still programs out there for financial assistance that we have knowledge of, and we can help hook you up with that. So.
And you make me think too about the housing crisis, which has just tripled and quadrupled lately, over this past year and a half, when market prices have gone up and people have wanted to sell their homes and then people get displaced. How do you see that impacting the people that you serve?
This is such a hard place to find places to live in. I did just learn that there's another low income housing unit going up in Fort Bragg. There'll be 69 new houses there, and it looks like they're hoping for a fall winter opening. So that's a positive. I know that's not right here, but at least it is not too far from us. I did just read something recently about the eviction moratorium still going on, so that people cannot be evicted. I know that doesn't necessarily stop the evictions, but so I wish I had an answer, Leanne. I wish that things were a little bit better. And it is a problem. And it always, even prior to COVID, it was a difficult thing here in our little area to try to find housing. New teachers coming in, new staff coming into RCMS, people have a difficult time finding a place to live. So that continues, unfortunately.
It does. And we have Jamie Sundstrom, who is a realtor in the area and of course has big family ties all throughout here. She's helping us with a housing roundtable that we hope to be able to announce soon and when we will have that. But she's helping to coordinate a variety of different people who can talk about perhaps what some of the solutions might be. So that we will let everyone know. Right now, I just want to thank you all again for coming on KGUA on Peggy's Place. That's Mendonoma Health Alliance, and that's Heather Reggelbrugge, Stephanie Chapman, Joanne Gamble. Ladies, thank you so much again for joining us today and letting us know all these new announcements and programs that you've got going on.
Thanks, Leanne.
Thank you.
Thank you.
Have a great day. And with that, I'm going to also say goodbye to our YouTube crowd as we are going to be